Welcome back to our All Ass No Gas education series. But before we get started, we'd like to thank our two newest sponsors, Helena Angry Enterprises and Big Sky Bungee of Great Falls.
Yes, thank you guys so much for your support. Today we get to talk to gastroenterologist Dr. Stephen Ayres. He'll answer all the most common questions that we hear, as well as ease any nerves you might have going into a screening colonoscopy.
Correct. And if you have any questions, as always, drop them in the comments below and we'll do our best to get them answered. Now, sit back, grab some popcorn, and prepare to be enlightened.
My name is Steve Ayres. I am a gastroenterologist. I have been doing gastroenterology in private practice for almost 44 years.
What is a colonoscopy and why do people need to have one done?
A colonoscopy is a way of examining the colon and the rectum with a long, thin tube that has a camera on it. If you can imagine that the colon is a long, soft, fleshy tube that has an inside lining, kind of like a little thin carpet. The colonoscope is passed gently through the rectum and then passed to the beginning of the colon so that it can examine the inside of the colon. So people need colonoscopies for two broad categories of reasons. The one we know the best is called screening colonoscopy, and it is a way to look for an increased risk of colon cancer and to prevent colon cancer by removing polyps. The other main category is if somebody has symptoms and they need a diagnostic colonoscopy. Symptoms might be blood in the stool or abdominal pain or severe change in the bowel movements. Then they have a test with the colonoscopy that's called diagnostic, trying to find a disease process that's present.
Why do we start our screening colonoscopies at the age of 45, and why did it change from 50?
Good question. And lots of people ask that question. Traditionally, colon cancer screening colonoscopy and other tests for screening for colon cancer started at age 50. And the reason for that is that because at around age 50, the risk of cancer, the incidence of colon cancer started to rise above people who were average risk and younger. And that was determined to be the best time to really begin to focus on that screening. The reason it switched to age 45 is that unfortunately we started to see colon cancer in young people in their early 40s, in the mid 40s, and it became very serious with people dying from colon cancer. And so the societies that make this recommendations, the academic societies, looked at all the data, and the National Cancer Institute suggested that we make that change to go to age 45, and then everybody else followed along.
In your opinion, why do you think colorectal cancer is becoming more prevalent at a younger age?
One of the things that's been put out is the increased consumption of processed foods. It hasn't really been well defined, but it just appears to be that that's the case.
How big are colonoscopes, and are there different sizes?
The standard colonoscope is about 4.5 feet long and just about a little over a ½ inch in diameter. So they're not really very big. There are different size scopes though. We typically use an adult scope, which is what I described, and then a pediatric scope, which has the same length, but it's just a little bit skinnier.
Why would you use an adult scope versus a pediatric scope?
Well, sometimes we actually find areas in the colon that are somewhat narrow, and we can't get the larger scope to go through. And then other times we know that somebody's anatomy is a little bit different than the next person, or maybe just their body habitus is somewhat smaller, and we would just elect to go with the smaller scope.
Should I expect to be in pain after my colonoscopy? And if so, what would cause that?
Well, that's a good question. I think a lot of people are concerned about having pain at some point during the procedure. And this day and age, almost never have pain after a colonoscopy. And we do several things to try and help prevent that. One of the things we do is actually use carbon dioxide when we're doing the procedure, because when we try to inflate the colon like little balloons so that we can see, if we use carbon dioxide, it actually gets absorbed in the tissues and comes out in your breath so that you don't have to pass that, and people after the procedure aren't bloated. When we remove things from the colon, the nerve endings aren't like you would have in your skin or your joints, and people really can't feel if you did any little surgeries to remove growths. So pain is extremely unlikely after a procedure.